Hey everyone, welcome back. So let's take a look at how a Gestalt therapist might treat OCD. All right, let's take a look here. Gestalt therapy offers a holistic and present-focused approach to treating obsessive-compulsive disorder, which differs significantly from more commonly used treatments like exposure and response prevention, ERP, from cognitive behavioral therapy, CBT. While traditional OCD treatments often focus on directly challenging obsessions and compulsions, Gestalt therapy aims to increase the client's awareness of their entire experience, thoughts, feelings, bodily sensations, and how they interact with their environment in the here and now. Here's how a Gestalt therapist might approach treating OCD. Focus on present moment awareness, here and now. A core tenet of Gestalt therapy is to bring the client's awareness to their present experience. For someone with OCD, this means helping them notice their thoughts, urges, and physical sensations as they are happening, rather than getting caught in the cycle of obsessions and compulsions. This can involve slowing down, guiding clients to slow their speech and thoughts to create space for feelings and sensations to emerge, grounding, helping clients build stability and security within their bodies to establish a baseline of safety, which can be particularly helpful for managing anxiety associated with OCD, bodily awareness, drawing attention to physical manifestations of anxiety or tension related to obsessions and compulsions. For example, shallow breathing, fidgeting, muscle tension. The therapist might ask, what are you noticing in your body right now as you have that thought? Or can you give voice to that sensation in your chest? Explore contact styles and interruptions. Gestalt therapy views psychological disturbances, including OCD, as dysfunctional relational styles or interruptions in the natural process of contact between the individual and their environment. For OCD, this might manifest as retroflexion, turning energy or impulses back on oneself, which could be seen in self-criticism or self-punishing aspects of compulsion. Dereflection, avoiding direct contact with an experience or emotion, perhaps through excessive rumination or ritualistic behaviors that distract from underlying feelings. The therapist would help the client become more aware of these patterns and explore how they prevent authentic engagement with their needs and emotions. Uncovering unmet needs and polarities. OCD can be seen as an attempt to control perceived chaos or address unmet needs, often stemming from early life experiences. A Gestalt therapist may help the client identifying underlying fears. What is the terror that the compulsions are trying to cover? What experiences or emotions is the client trying to avoid? And explore polarities. People with OCD often struggle with opposing forces, control versus chaos, perfection versus imperfection, powerfulness versus helplessness. The therapist would help the client acknowledge and integrate these opposing parts of themselves, rather than trying to suppress one side. Creative and experiential techniques. Gestalt therapy utilizes various techniques to deepen awareness and facilitate emotional expression. Empty chair technique. This can be used to externalize an obsessive thought, a compulsive urge, or even a critical internal voice. The client can then have a dialogue with that aspect, gaining new perspective and potentially finding resolution. Role-playing. Clients can explore different facets of their OCD or practice new ways of responding to triggers. Exaggeration. The therapist might ask the client to exaggerate a particular gesture or expression related to their OCD to heighten their awareness of the underlying feeling or impulse. Dream work. Exploring dreams can provide insights into unconscious processes and unmet needs related to OCD. Therapist-client relationship. The therapist-client relationship is crucial in Gestalt therapy. The therapist provides a safe, non-judgmental space, offering empathic understanding and staying present with the client's distress. This allows the client to gradually uncover and integrate difficult emotions that may be fueling their OCD. Important considerations. While Gestalt therapy offers a unique and potentially valuable perspective on OCD, it's important to note there's limited empirical research specifically on OCD. While Gestalt therapy has shown effectiveness for anxiety disorders in general, there is less specific empirical research on its efficacy for OCD compared to treatments like ERP, which is considered a first-line evidence-based treatment for OCD. May be used complementarily. Gestalt approaches might be used as a complementary therapy alongside more evidence-based treatments for OCD, or for individuals who haven't fully responded to other modalities. And focus on process over content. Gestalt therapy emphasizes how the client experiences their OCD, the process, rather than solely focusing on the content of their obsessions or compulsions. Ultimately, a Gestalt therapist would work with the individual to help them become more aware of their entire experience of OCD, how it manifests in their body and mind, and how it impacts their contact with the world. By fostering this awareness, the goal is for the client to gain greater choice and freedom from the rigid patterns of OCD. So what do you think? What do you think about how Gestalt therapy treats OCD, and would you want to be treated this way for OCD? Let me know in the comments, and I'll speak to you next time.